Hey guys, good morning and welcome to my channel. My name is Violet Okolocha. So today we'll be starting our self-study. So today is actually officially day 1 of our self-study. So guys, welcome officially to our first day of our self-study. So we're going to be dissecting everything you need to know about assessment. Now, if you are having musts and PHQ9, of course, you know must and PHQ9 is always in the community. So the patients don't wear wristband, all right? If you are having GCS and you are having news, it's always in the hospital setting. So the patients will be wearing what? A wristband. So today, in line with dissecting everything you need to know about assessment, I bet you are going to enjoy this video to the end. And at the end of this video, I'll be giving you 6 assignments. I'll be giving you 6 different case scenarios, and the assignment I'm giving to you is practice on your own with those 6 different scenarios. Then give me the 6 different care plan you will do for those scenarios. Pop your care plan online. I will mark it. Pop it on the YouTube comment section so that other people can as well benefit from it. So if you took Osce, if you took your CBT exam by August, you took the new CBT exam, you are having the new Osce. You are having the new Osce, and in the new Osce, you are doing 10 stations. So if you took the old CBT, you are having the old Osce, which is 6 stations. So those who took the old CBT and you get a mail, you are having 10 stations, you have to email NMC and clarify with them. Those who took the old CBT, they are having the old Osce, which is 6 stations. And if you took the new CBT, which is, I think it started August, you are having 10 stations. So for today, I'm dissecting everything you need to know about assessment. Assessment on your Osce exam is 5 minutes. Don't be thrown off balance if your assessor tells you, assume you've checked for scene safety, assume you provided privacy. If she tells you like that, go straight to your hand hygiene. Is that all right? So I'll be starting this video with must. Must is is a very, very simple station. Very, very simple. And the time allocated to all the station is 15 minutes. So guys, come with me and let's get started. I'll be using a very lovely friend of mine today. Although she's not showing in the camera, I'm not using a mannequin because I expect you to have watched my video on must, watch my video on PHQ9. So this is just like to refresh your memory, all right? So I'll be starting with must. So if you are doing must, what you should expect to get is this. You are going to have a lot of documents, this. You are going to have a lot, but this is the main thing I want you to take note of. On this form is going to be colored. You are going to be seeing the patient's name, the patient date of birth already written for you, and you are going to see the circled. Step 1 will be circled, step 2 will be circled. They will circle for you what they want. So if they don't circle for you, if you look at this categorically, step 3 was not circled. Anything they don't circle for you, don't calculate it. Like now, what are you going to calculate here? Step 1, step 2, 2. That has been circled for you. So the total score is is 2. So all you need to do is go over to the patient with the charts. Before you go over to the patient, you'll be given 5 complete minutes to read your scenario. In that 5 minutes, you already know either you're having must, either you're having PHQ9, either you're having news, either you're having GCS. It's clear. But when reading it, you already know the scenario you'll be having. So after your 5 minutes elapsed, walk straight to the patient. So I said, so are you ready to cut me short when I start? Yeah. Okay. I approach my scene. I see my scene is safe to approach.
Can you skip that and just go down?
Perfect. So that is how you may see it in your exam. Your assessor may tell you skip that. And if she tells you skip that, go straight to your hand hygiene. So I'm going to be applying gel on my hand. I do my hand hygiene now, palm to palm. If you like, you can wash your hand. The first hand hygiene is very vital because they will really watch you. Palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, rotation of the form, tips to the finger, and the wrist. So my hands are clean. I go over to assess my patient. Hello.
Hello.
My name is Violet and I'm one of the nurses looking after you today. Can I just confirm your full name and date of birth with you? Is that alright?
Yeah, my name is Halle Bro.
Perfect. And your date of birth?
My date of birth is 15th February 1940.
Perfect. Can I double check that with you with what I have here?
Okay.
Lovely. There's no wristband, remember. So I have here Ailey Brooks, date of birth 15 February 1940. Alright. So Ailey, the reason I'm here this morning is because I want to assess you using the Malnutrition Universal Screening tool. Is this a convenient time to do that?
Yeah.
Lovely. And are you having any pain at the moment?
No.
Lovely. So after asking that, is either you do the observation first or you do this first, because in most you are doing an observation. That's why I was surprised when some people were asking me, do you do observation in most? Yes, you do observation in most, but you don't get this chart. This chart is for news. You get a similar chart to this. You get a similar chart like this. So you do the most and you do the what? Observation. You chart the observation. Alright, so let's go over. So I'm starting with what? With the most now. So Ailey, I can see under step 1, which is your BMI score. So BMI score is actually your height and your weight. So I can see your BMI score is between 18.5 to 20. Is that correct?
Yeah.
Perfect. So you see she's scoring 1. All right. So Haley, can I also confirm with you in step 2 that you've lost about 5 to 10% of body weight in the last 3 to 6 months? Is that correct?
Yeah.
Oh Lord, bless you. So I'm just going to be totaling your score. Is that all right?
Yeah.
Because obviously in step 3, I can see that for step 3 you've not been acutely ill. Have you been acutely ill?
No.
She's not been acutely ill. And have you been eating?
Yeah.
So she's been eating. So you see, that's why they didn't circle anything for you in step 3. Because step 3 is for a patient who is acutely ill and is likely to be no nutritional intake for 5 days. So they didn't circle step 3 because she's eating she has been eating obviously. So what do you have to do? Just total the score. 1 plus 1 is 2. So you total the score, you write your name, you write your you write your date, you write your signature, and that ends it. So Haley, you are having a total score of 2. And if you are having a total score of 2, turn to the back. You see, nothing to cram. 0 is low risk, 1 is medium risk, 2 is what? High risk. So Haley, because you are having a score of 2, and a score of 2 is a high risk score, so we are going to refer you towards to the dietitian. Are you happy for us to refer you to the dietitian?
Yeah.
Perfect. So I'm going to be setting goals to improve your overall nutritional intake. Is that all right?
Okay.
And we're going to be monitoring and reviewing your care plan. If you are in the hospital, it will be weekly. Because you are in the care home, it will be monthly. Is that all right?
All right.
Lovely. So Ailey, is it all right if I quickly do an observation on you?
Okay.
Lovely. So I'll do my hand hygiene. Palm to palm, right palm over left bosom, vice versa, fingers interlace, fingers interlock, rotation of the thumb, tips to the finger, and the wrist. I'll put on my apron, I'll put on my glove, and I will do what? Our observation. Before you do the observation, check the hand. Haley, have you had surgery in your hand?
No.
And are you happy for me to use your left hand?
Yeah.
I can see your left hand. I see there is no inflammation. I see there is no fistula. I see it's not edematous. I'm happy to tie my cuff 2 to 3 centimeters away from the cubital fossa. All right. You may feel some tightness while I do that, but don't worry. It's just for a while. All right.
Okay.
You do your what? Observation. Can I check your ears?
Yeah.
Do you have any discharge at all from your ears?
No.
Oh, there's no discharge, and I can see there is no hearing aid. So I put my probe. You take your temperature. Can I count your pulse? Is that all right?
Yeah.
All right. So I'll be counting your pulse. I'll be counting your pulse for 2 minutes. Is that all right?
Yeah.
So put your 2 hands on the radial artery. And some people have been asking me, will you see pulse there? Will you see a timer there? If you are having a live patient, don't worry yourself. They'll be providing you with what? With a stopwatch. All right. So don't worry yourself about that if you're having a live patient. But if it's a mannequin, you know they will give you all the what? All the values. So all right, I'll be counting your pulse for 2 minutes. All right, it's 2 minutes now. So Haley, I actually counted your respiration for 1 minute and I counted your pulse for 1 minute because I didn't want you to know while I was counting the respiration so that it doesn't alter the reading. Is that all right?
Okay.
So Thank you so much. So I've checked her respiration, I've checked her pulse, and I've checked what? Her blood pressure. So when you are doing MOS, there is no space. Sorry, I'm looking for the chart. Lovely. When you are doing MOS, there is no space to count out the new score and say you have news of 6 or news of 4 or news of 7. Look, this is a similar chart you'll be getting. All right, so this is a similar chart you'll be getting. So you don't have to say you're having a new score of this no for most. You don't have to do that. So all you need to do is to what? Is to quickly chart your what? Your observation. So Ailey, can I just check your SAT? You just check the patient's SAT. I don't know if they've have a space for SAT now. You know things keep changing in the Osce exam. So I will chart everything. Chart acts they want you to chart everything. Write the patient's name. If it's not written, write the year, write the date, write the time, chart everything, and you go over to the patient. So Ellie, thank you so much. Your observations are quite good depending on what you get. If the blood pressure is high, you can just say your observations are quite good. All right, can I just ask you, Ellie, how do you comply with your medications? Do you take your medications regularly?
Sometimes I do.
Oh, bless you. You start your what? Health education. Haley, I just want to encourage you to take your medications as at when due, all right? It's very important because when we take our medications, we get better, all right? Okay. Do you smoke?
No.
Do you drink?
Yeah, sometimes.
Oh, bless you, all right. Do you consider quitting drinking anytime soon?
No, I've never thought.
Lovely, lovely. Lovely. So Haley, how do you mobilize? How do you get along activities of daily living? Do you walk with a Zimmer frame? Can you walk well?
No, I walk with a Zimmer frame.
Oh, bless you. And are you having any osteoarthritis?
Yeah.
Oh, bless you. All right, that's okay. Are you happy for us to refer you also to the osteoarthritis team? Is that all right?
Yeah.
Because that is going to be beneficial for you, all right?
Okay.
Lovely. So, Haley, do you have any concerns for me at all?
No.
Oh, lovely. So, you see, this is how it is. MOS, very simple. Immediately you're finishing the observation, you're finishing calculating your MOS, the next thing you need to do, how do you comply with your medication? Do you smoke? Do you drink? You know, and that's it. Then you educate the patient. Take your drug regularly, all right? How do you do this? Do you want to? Lovely. So is that what? Is that simple? So the next thing we're going to be going about is what? Is PHQ-9. PHQ-9. So PHQ-9 is also another assessment in what? In Osce. Very, very, very simple. So PHQ-9 is 15 minutes and it is in the community setting. So PHQ-9 is also in the what? Community setting. So don't expect to see what? To see any wristband. So I'm going to be starting afresh with PHQ-9 and I'll go over to my patients and just like that. So you have to watch my video on PHQ-9 more so that you understand how to practicalize this skill. It's very simple. So they give you 5 complete minutes to read your scenario, digest it, understand it. You already know where you're going to, all right? So I'm going to be showing you how the PHQ-9 works. This is what you are going to be getting for PHQ-9. Is this clear? You know, this is what you're going to be getting for PHQ-9. This is what you're going to be getting. And you're going to be getting this as well for PHQ-9 to chart the what? To chart the observation. I hope it's clear enough. So they are going to be circling. Because somebody asks a question of about something, I'm going to be circling some. So it's going to come circled. You see, so in this PHQ-9, I will advise you to ask only 3 questions because of time. I will advise you to ask only 3 questions because of time so that you can minimize your time. Don't ask more than 3 questions. And those 3 questions you are going to ask the one the patient is scoring what? Is scoring the highest score. And for PHQ-9, 3 is the highest score. So look for the one the patient is scoring 3. If the patient is scoring 3 in 2, ask the one the patient is scoring 3 in 2. And if the patient is scoring 1, 2, you ask. So now I'm going to be asking the patient questions according to this. So you do again. My assessor is going to cut me short as I start. If they don't cut you short, complete the process. I approach my scene. I see my scene is safe to approach. I provide privacy for my patient. All right, lovely. So I do my hand hygiene. Once they say continue, go to your what? Hand hygiene. Palm to palm. Right palm over left dorsum, vice versa, fingers interlaced, fingers interlocked, rotation of the form, tips to the finger, and the wrist. So my hands are clean. I can now approach my patient. Hello,
Hi.
my name is Violet and I'm one of the nurses looking after you today. Can I confirm with you your full name and date of birth?
My name is Joanne Ari.
Okay, Joanne Ari, and your date of birth?
My date of birth is 15 March 1943.
15 March 1943. Is that all right if I double check with what I have here? Is that all right?
Yeah.
I have here Joanne Ari, date of birth 15th of March 1943. She doesn't want me to use Ailey. She says I use Ailey all the time, so she's giving me a different name. All right. So the reason I'm here is because I want to assess you using the PHQ-92. But before I do that, can I just confirm with you? Do you have any allergies at all to food, drug, latex, or adhesive?
No.
You have no allergy, so perfect. So the reason I'm here today is because I want to assess you using the PHQ-92. Is that all right with you?
Yeah.
Bless you. So from what I have here, I can see that you have little interest or pleasure in doing things nearly every day. Is that correct?
That is right.
Oh, don't worry, that's why you're here. We're here to help you, okay? And from what I can see also, I can see that you find trouble falling asleep, staying asleep, or sleeping too much nearly every day. Is that correct? So if you are wondering where I'm getting nearly every day, for the score of 1 is not at all, for the score of 0 is not at all, for the score of 1 is several days, for the score of 2 is more than half the days, and for the score of 3 is nearly every day. So because she's scoring 3, I read it and I say nearly every day. So I'm going to do the one of 2 so that you get. So I can see that from what I have here, you're feeling tired or having little energy more than half the days. Is that correct?
Yeah, that's correct.
Oh, bless you, bless you. So I'm just going to be totaling your score. So total the score 0. There's no space for 0. How many 1 can you see here? 1, 1. So you put 1 there. For the 2, how many 2 can you see there? You can see we have 1, 2. So you put 1, 2 there. For the 3, how many 3 can you see there? You can see we have 3, 3. 3, 3, 3 is 9. You put it 9 there. So what do you do now? You total 9 plus 2 plus 1. So 9 plus 2 is 11 plus 1 is 12. So you total the score 12. So this patient is having a PHQ-9 score of what? Of 12. So you go over to the patient. Haley, from what I can see, you are having what? A PHQ-9 score of what? Of 12. Now, don't cram anything, turn to the back. PHQ-9 score of 12 is what? Is minor depression, because it falls under 10 to what? To 14. So, Haley, I can see that you are having a PHQ-9 score of 12. And PHQ-9 score of 12 is minor depression. So, what we'll do is we're going to support you, do watchful waiting for you, and we're going to commence you on antidepressants or psychotherapy. Are you happy for us to do this for you?
Yeah.
All right, lovely. So, Haley, are you happy for me to quickly do your observations?
Yeah.
So do our observation. Can I check with you your left hand? Do you have any surgery in your left hand?
No.
But before you do the observation, do your hand hygiene. Do your hand hygiene. Put on your apron, put on your glove, assemble your equipment. Check her left hand if she's had any surgery, any edema, any swelling. Tie your cuff 2 to 3 centimeters away from the cubicle fossa. After doing that, Ayeli, are you happy for me to check your pulse?
Yeah.
Lovely. I'll be checking your pulse for 2 minutes. Count the respiration for 1 minute. Count the pulse for 1 minute, but don't let the patient know so that it doesn't alter your reading for the respiration. After that, Haley, can I check your ears?
Yeah.
Do you have any discharge from your ears? Yeah. Obviously, there is no discharge. You take your what? You take your temperature. Can I check your fingers?
Yeah.
Oh, I can check your fingers. I can see. I do a capillary refill for is less than 2 seconds, and I'm happy to put my probe. So I don't know if they've added probe now, but otherwise, this is what you get. Just temperature, pulse, respiration, and blood pressure. Then you chart it. Chart it according to the way they ask you to chart it. Like you see, for blood pressure, they expect you to draw an arrow. For pulse, they expect you to dot it. For temperature, they expect you to cross it like an S. Then they expect you to write your respiration and what? You sign your name. All right, Haley, thank you so much. That's all done for you. Haley, do you comply with your medications?
Sometimes I do.
Oh, Haley, I'm just going to encourage you to comply with your medications, all right? Okay. When we take our drugs, we get better. Is that all right? Okay. So, Haley, I can see from what I have here, you find it very difficult to mobilize. Is that correct?
That's correct.
And I can see you lost a very important person to you. You lost your dog. Is that correct?
Yeah. have.
Oh, bless you, bless you. And because you lost your dog, you've been very unhappy. Is that correct?
So correct.
Oh, bless you. So are you happy for us to refer you? We're happy to refer you to the... So are you happy to for us to refer you to the team that handles everything about bereavement?
Yeah.
Is that all right?
Yeah.
So we're going to be referring you to them, okay? And because of how you're feeling, if you don't mind, are you happy for us to refer you to the mental health team as well?
Yeah.
So we're happy to refer you. So Haley, do you smoke?
No.
Do you drink?
Yeah, I do.
Oh, you drink. Lovely. Do you consider quitting drinking anytime soon?
No, I don't.
Okay. So, Ili, have you been eating well? Because from what I can see, you've not been eating well. Is that true?
That's correct.
Oh, bless you, bless you. Is it because of what happened to your dog?
Exactly. I miss him a lot.
I know. Tell me about it. So, Haley, what I'll do for you, I'm going to be referring you to the dietitian if you are happy with that, so that they can help you and make sure you meet your nutritional status. Are you happy with that?
Okay.
So, all right. So, Haley, for your mobility, do you feel pains when you mobilize?
Yeah, I do.
You feel pain. Is it a serious pain? If I ask you to score your pain 0 to 10?
I think 4.
I think 4. Okay. So have you been used to that pain, having the pain anytime you mobilize?
Yeah, sometimes.
Okay, so I also refer you to the pain management thing. Is that all right?
Okay.
Haley, do you have any concerns for me at all?
No.
Lovely. So for now, before I refer you to the dietitian, I will encourage you to take enough fruits, enough vegetables. Are you all right with that?
Okay.
Lovely. So Haley, thank you very much. All right. So remember, I took after I would have taken my apron out already. So then you do your hand hygiene and you leave the patient. You see, guys, you see how simple Osce can be. Very simple. So PHQ9, very easy. And the next thing you have is what? Is GCS. This is the chart for GCS. GCS is very easy. Now, because GCS is very easy, I'm going to tell you some certain things I want you to note for GCS. Don't make GCS hard. GCS is what? Is very easy. So if you are having a live patient for GCS, you have to try as much as possible to be quick. If you are having a live patient, if you are not having a live patient, you just try as much as possible to meet up with the time. Already, for 5 minutes, you have read the patient's scenario. You have read, you know everything about the patient. And most likely for GCS patients, they are most likely to be confused. They can obey command, but they are most likely to be confused. You do your blood pressure. So I'm going to be doing GCS quickly for you. I'm not doing it the real way because I expect you to have watched my video on GCS. I'm just trying to refresh your memory, telling you how to chat. Is that all right?
Okay.
Lovely. So let's get started. I approach my scene. I see my scene is safe to approach. I provide privacy for my patients and I do my hand hygiene. You see, this time I did it to the end because my assessor didn't stop me. Do your hand hygiene. So GCS is always in the clinical setting. Always in the what? In the clinical setting. So you have to check the what? The patient's wristband. Hello. My name is Violet. I'm one of the nurses looking after you. Can I confirm your full name and date of birth with you?
Okay, my name is Margaret Joan.
Margaret Joan. And your date of birth, please?
My date of birth is July 13th, 1940.
13th of July, 1940. Perfect. Is that all right if I double check that with your wristband?
Okay.
Lovely. So double check with the wristband. This is the red wristband, and we have what? Margaret Jones, date of birth, 13th of July, 1940. Perfect. So Margaret, can I confirm with you if you have any allergies at all to food, drug, latex, or adhesive?
Yeah, I'm allergic to penicillin.
Oh, bless you. What happened when you take penicillin, Margaret?
Anaphylaxis reaction.
Anaphylaxis. All right. So that is well documented, and that is why you're wearing a red wristband. So nobody's going to give you anything that contains penicillin. Is that all right?
Okay.
Lovely. So Margaret, the reason I'm here is because I want to assess you using the GCS. I want to use the GCS to assess you. Is this a convenient time to do that?
Yeah.
And are you happy for me to do that quickly?
Yeah.
Lovely. So I'm just going to be assembling my equipment. While I go, I'm going to be leaving you with a call base. Is that all right?
Okay.
So assemble all the equipment you need. If it's a live patient, if it's a live patient, of course, you know you need this, you need it. Assemble all the equipment. So before you go, do your hand hygiene, palm to palm, right palm over left, do so, vice versa. Fingers interlace, fingers interlock, rotation of the form, tips to the finger, end the wrist. So my hands are are clean. Put on your apron, put on your glove. If it's a live patient, assemble your equipment and you go back. If it's a mannequin, you continue. All right, Margaret, do you know where you are at the moment?
Yeah, I'm at the hospital.
You are at the hospital. You see her eye opening is spontaneous. She's answering me, so you know she knows where she is. She's at the hospital. Everything is opening. She's answering. So if it's a live patient, the eye opening is spontaneous. If it's not a live patient, they will give you a score for you to chat at the end of the day. So let me assume they are giving me a score. So Margaret, can I just ask you to do something for me?
Okay.
Can you raise your hand for me? You see, she raised her hand. So that means she obey command. So what will she score there is 6. That is, I'm talking of those who will be having live patients. So she raised her hand, so she's scoring 6. That means she does what? She obeys command. If you don't want her to raise her hand, you can just ask her, Margaret, can you pop out your tongue for me? So when she pop out her tongue, anything, you just to see if she does what, if she obeys command. Then you quickly what, you write it according to how you are seeing what, how you are seeing it. So she doesn't look confused. You can see she's oriented. I asked her, do you know where she is? She said in the hospital. Okay. Sometimes some of them might be confused, but they know they're in the hospital. I'll ask her another question. Margaret, do you know what time of the day it is?
Yeah, this is 6 p.m.
Oh, lovely. So she knows everything. So she's oriented. So obviously you can see eye opening is 4, oriented is 5, and obeys command is 6. So this patient obviously scoring 15/15. All right, Margaret, can I quickly do a quick set of observation on you? Is that all right?
Yeah.
I'll check her left hand. I can see there's no inflammation on her left hand. I can see. Have you ever had surgery in your left hand?
Yeah.
Tie the cuff 2 to 3 centimeters away from the cubicle fossa. After tying the cuff, and you take your reading, you chart your blood pressure here. I will assume our blood pressure is 130/80. Chart your blood pressure here, 130/80. Margaret, can I quickly count your pulse?
Okay.
I put my hand on a radial artery and I do a pulse for 2 minutes. I use 1 minute to count the respiration. I will use 1 minute to count the pulse. So the pulse is 90 and I put 90 here. Lovely. And because I counted our respiration for complete 1 minute as well, I'll chart the respiration. I'll put a dot here. Respiration is 20. Margaret, is it all right if I check your ears?
Yeah.
I check your ears. I see your ears. There is no inflammation. And I take your temperature. So take our temperature, whatever it is. I will assume our temperature is 37. And I come here. I circle 37 degrees Celsius. So Margaret, I'm just going to be checking your arms and your leg. I want you to hold my hand. Yeah, try to resist me as I put pressure on your hand. Try to resist me. Lovely. So I can see for your left hand is normal power. Can I check your left hand? I'll put pressure on you. Try to resist me. Oh, lovely. So for our arms, right hand is normal power and left hand there is mild weakness. Can I do that on your leg? Check the leg, apply pressure on the leg, tell her to resist you on the leg. If she resists you and you see, you know it's normal power. If it's mild weakness, so for the leg, it's normal power for left and what and right. So you're just going to be checking the eyes. Margaret, can I check the size? Can I check your pupil, please?
Yeah.
Lovely. I'm going to be checking your pupils. All right, lovely. I'm just going to be using this to also check for the dilatation and to check if it reacts or if it dilates. Is that all right?
Okay.
So I'm going to be pointing the torch. Lovely, lovely. So for the pupils react. I'm very happy with that. And the size of the pupil is 3 millimeter. And the pupils react both for right and left. So I'm just going to be totaling the GCS score. Margaret, can I just check your saturation? Is that all right? I do a capillary refill. I see it's less than 2 seconds. I put a probe on it. I'm having 97 for the saturation. Lovely. Lovely. So guys, everything is all done. So I take off my apron. If it's a live patient, now you've done everything. Take off your apron, take off your glove, do your hand hygiene. If it's a mannequin, you just verbalize you will wear glove. Mannequin is always easier, so you can check out my videos on GCS. All right, Margaret, everything is all done for you. Margaret, with what I have here, I can see you are having a GCS score of 15.
Okay.
Lovely. So GCS score of 15. We're just going to keep monitoring you, all right? We're just going to monitor you because you're having a GCS of 15. So we're going to just keep monitoring you and see how it goes. We're going to monitor you according to the NICE policy. Is that all right?
Okay.
Lovely. So that's all done for you. So Margaret, are you having any pains at the moment?
Yeah.
If I ask you to score your pain, 0 being the least and 10 being the highest, what will you score?
Is it 3?
3. So the pain has really subsided. So Margaret, what happened? How did you have the fall? What happened? How did you hit your head? What happened? Can you remember anything?
Yeah, I just a little. I remember I was going to the toilet.
Okay.
And the other thing I saw is I'm in the hospital.
Oh, bless you. So you don't remember if you hit your head?
No, I don't.
Oh, okay. And so the pains and the headache have all subsided?
Yeah, they
all
are.
right. So Margaret, do you comply with your medications?
Yeah, I'm trying to.
So you do comply. All right. So I'll just have to encourage you to keep complying with your medication. Take your drugs when due. Is that all right?
Okay.
And Margaret, because you said you are having pains of about 4, when I'm done with this observation, I'm going to be happy to check with the doctors and see if you have any pain medication. If you don't have, they'll be happy to pop you on any one. Okay, that'll make you feel better. Okay.
Alright.
So Margaret, how do you mobilize? How do you get along with activities of daily living?
Well, I use Zimmer frame.
You use the Zimmer frame to mobilize,
Yeah.
and your mobility is all right. So how is your elimination pattern?
It's okay.
Lovely. Do you smoke? Do you drink?
Yeah, I do smoke. once in a
Oh,
while.
how many cigarettes do you smoke per day?
I said 2.
Oh, 2 cigarettes. Do you consider quitting anytime soon?
I think so.
Okay, lovely. So are you happy for me to refer you to the smoking cessation team?
That would be good.
Lovely. So that's good. So Margaret, I'm very happy with you because your GCS score is now 15, and I'm happy you comply with your medication. How is your nutrition pattern? Do you eat well?
Sometimes I do.
Okay, lovely. So if you eat well, I'll just advise you to keep on eating well. Take your medications as at when due. Take enough fruit, take enough vegetables, and drink enough water. Okay.
Alright.
Lovely. So Margaret, I'll monitor you according to NICE policy. All right.
Okay.
Do you have any concerns? Anything you want to share with me?
No.
Lovely. So now I'm just going to be checking with the doctors because of your pain of 4, and I'll get back to you and see what medication we can give to you. All right.
Okay.
Thank you so much. Do your hand hygiene, and that's all for GCS. Very simple. And the last one is what is news. My advice to you for news is try as much as possible to check the chat very well. News can be very dicey. Some people chat the news, and at the end of the day, they forget to chat if the patient is on air or if the patient is on respiration. And that's why I said to you in my last video, don't do anything that is not important. Like some people will say, hello, my name is Violet. I'm one of the nurses looking after you. Can I confirm your full name? The person will tell you their full name, date of birth, hospital number. You check with the raised bar, and they'll say, what do you like to be called? All those are things that can waste your time. If you're very good with time, you can go ahead. There's no need to ask what do you like to be called if you know you are not very good with time. You're not very good with time. So because the time remaining is for you to check your charts. Check your chart. After chatting, check your chart. Chart at the correct line. A lot of people are asking me, how do you chart? Do you have to put numbers? You don't have to put numbers. Put a dot. You can see the way I'm charting here. Put a dot. If this is not clear enough, you can check my video on don't chart your news like this. Put a dot. You see the BP. I drew an arrow. This is how I expect you to chat. If the patient is on air, you see this patient is on air, I put air. And always use what? K1. I've said that a lot. Use K1. So chart your news accordingly. And some people are asking me, what if the patient is having 3 in a single parameter? Patient is having 3. If the patient is having 3 in a single parameter, you write 1 hourly. You are not wrong. Because obviously the patient is scoring 3 in a single word, in a single parameter. Let me give an example. Imagine a patient having 220 of blood pressure, 220 over 80, and you are like, hey, this patient is having 3 in blood pressure and having 1 in temperature, so the patient is now having 4. Because the patient is having 3 in one parameter, what should I do? And if it's 4, if it's news of 4, it's 4 to 6 hourly. Now the patient is having 3 in the same. If you put 1 hourly, you won't fail. Nobody will fail you. So don't worry about those things. Chart well. Check your chart and check your chart and check your chart. Check very well to make sure you are charting well. Check your chart over and over again. So use the remaining time to check your chart over and over and over again that your charting was correctly. And I'll just quickly answer the questions a lot of people have been asking me. I wrote down some, I didn't write down some. Some people are asking, do we have to go with breast watch and pen? The answer is no. All those things will be provided for you. You only need a breast watch if you have a live patient. And so if they are giving you a live patient, they're going to be providing a breast watch for you. For pen, they will provide pen for you. So don't worry about that. Now, somebody else asked me, if you are using a live patient, do you have to use the automated pulse value? The answer is no. You have to count your pulse manually. Don't use the automated value for pulse. Count your pulse words manually. And don't fake any value. Some assessor will be counting in the other hand while you are. So don't fake any value. Calm your nerve down and count your pulse for words. Complete 1 minute. And some people also ask me, why do you always address patient by honey, sweetheart, lovely, this and that? Is it all right to address them with endearing names? Now, to be honest, it's most preferable to address patients by their names. So address them by their names. I'm very used to addressing patients by lovely names right from time. So that's why you see me doing it. Sometimes I do it all intentionally. So if you even doing my own Osce exam, I even address patients with endearing names because it's all part of me. But I would advise you, address patients by their names if you like it. And so address patient by their name. I've been doing this for a long time, addressing patient by endearing names. I've found myself doing it for a long time. So a lot of people are asking me, is it all right to address them by endearing names? Address them by their names if you are happy with it. And somebody here asked me, for PHQ9, can you do it in a rough document first before transferring it? No, I'm afraid for PHQ9 you can't do it in a rough document. And another person is answering me, if a patient is scoring 4, what do you do? I want to query that here. You know why I will query that? Sorry, I have to take time to do this. This video is very, very long. I can't split it, I'm afraid. I can't split it. I don't even have the time to split it. I query that a patient will score 4 in the PHQ9. Do you know why I query it? Sometimes, because of how anxious we are, we miss scores. If you're very anxious in the exam, you miss scores. I'm querying it because I'll tell you the patient is scoring more than 4. So when you go for your receipt exam, don't worry. Just balance well and look at it. Receipt happens to everybody, so don't worry. When you go, just look at it very well. The patient is not having a score of 4. I will query it. Patient is having a score of more than 4. And I'll tell you another reason why I'm querying it. I had a student who had subcutaneous injection insulin, and when she came back, she told me she had meals for the insulin injection. I said, no, you can never have meals for insulin injection. That's not right. But she insisted. So I said, when you go back for your receipt, just double check. It could be international unit. And funny enough, when she went back for the receipt, she was calmer. It was international unit. So I queried that you could have a PHQ9 of 4, because if you look here, is from 5 to 9. So just when you go back for your receipt, calm your nerves down, check properly, and you will see it's above 4. So just check, just be calm and calculate the score. Don't rush. That is why a lot of people fail news, because they forget to write A when they are supposed to put a dot. They don't tick any dot at all. So just calm down. Do it. Calm down and do it. Don't worry. If you're anxious in the exam, don't worry. You will all pass. The exam is very simple. So the next question I have here is, can you write figures for news? Don't write figures for news. Use dots. You can check my video on don't chart your news like that. I've written it down. Another person asks, if you have a mannequin, will you be provided with values? The answer is yes. If you have a mannequin, they will give you, I've forgotten what, a cue card. They call it a cue card. They will give you a cue card where all the vitals are there. Somebody asked me, for chatty patient that likes talking too much, how do you stop them? Very easy. This my colleague here is a nurse. I'm going to start being chatty with her and see how it goes. Hello, my lovely. Are you all right?
Yeah.
Okay. Let's continue with our assessment. Okay. Are you having any pain at the moment? She's going to be chatting.
I'm having a pain in my head.
If I ask you to score your pain, 0 being the highest and 0 being the lowest and 10 being the highest, what will you score?
I think 5. No, I think 7.
Oh, I'm gonna cut you there. Is it 5 or 7?
I think 7.
Oh, it's 7. Okay, yeah. Lovely. So you just try, and I'm gonna stop you there now. Can I just go to the next question? You just try, and I'm gonna stop you there, my love. You see, I said my love again because I'm used to it. I'm gonna stop you there, Haley. You just try and stop them there because the exam is time. If she's talking too much, all right, I'm gonna stop you there and take you to the next question. Just say nicely. And somebody has said, for subdural hematoma, what are the likely nursing diagnoses? I'm coming to my assignments. The assignment I'm giving you, you are going to be the one to give me the care plan. Before subdural hematoma, the first care plan that you come, the patient is having, Mrs. A is having headache, serious headache. I'm not going to give you the second one, but I expect you to give it to me because that's part of my assignment. And somebody else said, do you do observation in MOST and PHQ9? The answer is a big yes. You do observation in MOST and PHQ9, but it's not like news where you have to have the news score. And somebody else said, when will you start a WhatsApp and a Telegram group? That's a very big question. The thing is, when you start WhatsApp and Telegram group, before you know it, you have 10,000 messages. People will not stick to the nursing, but I don't mind considering it and saying, okay, all of you writing Osce in November, open a Telegram group for you. When we are a WhatsApp group, when we are done, we remove the WhatsApp group. Those writing in December, we put them. If it's like that, you want it like that, then I can consider it, because I have to be sure that you're writing Osce, not just putting people there. They're not writing Osce soon. So if you think that's meaningful, I'll open a WhatsApp group for those writing in November, and when they are done, I remove all of them. After they finish telling us the question they had, I remove them all and pop those writing December. If you're happy with that, I could consider it. And finally, if you had the new skills, you know the new skills, we have critical thinking. So for those who had the new skills on professional value, because for the new skill, you know, you are doing 10 stations, you do your assessment for 20 minutes, planning 40 minutes, implementation 60 minutes, evaluation 40 minutes, and you do 4 skills, 2 pairs. And the 2 pairs I'm talking about here is you had on professional values and critical appraisal, and you recited it. Please contact me. I'm very happy to help you. I'll be dropping a video on that professional value and critical appraisal soon. So I'm more than happy to help, okay? So guys, our assignment for today. I'm giving this assignment and I expect every one of us who are taking our Osce exam to do this assignment. I'm giving you 5 different skills. 5 different assignments. So the first one is on news. Mrs. Ellie Brooke is a 24-year-old lady who was admitted following a ruptured appendicitis and has been scheduled for an emergency surgery to repair his ruptured appendix. He is currently waiting for his appendectomy, which is due in 2 hours. This is my first assignment. Please plan his pre-operative care according to care needs during your assessments. So I purposely gave this assignment so that you see how to plan for post-operatively. So give me 2 nursing care plan. Pop your care plan on the comment section and I'll be happy to mark. Patient's notes. Please note, Mrs. Ellie is complaining of severe abdominal pain with a score of 7/10, and Mrs. Ellie smoked 5 cigarettes per day and is nil by mouth. I've said everything. If you forget what I say, all you need to do is to pause this video and take this assignment, Mrs. Ellie Brooks. And the second scenario is Mrs. Ellie Brooke is a 37-year-old lady who was admitted into the AMUA at 10 o'clock this morning because of cough, chest pain, and shortness of breath. Mrs. Ellie has been diagnosed with asthma. Mrs. Ellie smokes 2 packets of cigarettes a day and has a past medical history of hypothyroidism and hypertension. Note, she's normally independent but finding it difficult to carry out her activities of daily living due to shortness of breath and pain. So this falls under what? Under chest infection. In chest infection, you have asthma and the rest of them. So give me 2 nursing care plan. I'm happy to mark. For all those who will send their care plan soon, I'll be more than happy to mark it for you. So the first assignment, I want you to give me 2 care plans for the first assignment. Pre-operative care plan and post-operative care plan. Now, case scenario 3. Mrs. Ellie Brooke is a 79-year-old lady who was admitted following a fall at home with head injury, confusion, and poor mobility. Mrs. Ellie had a CT scan in accident and emergency department that reveals she had subdural hematoma. She has a past medical history of fall and vascular dementia. Note, this patient is having a GCS score of 14/15 and she's very confused. The patient needs assistance with mobility and she complains of severe headache with a pain score of 9/10. Note that Mrs. Ailey is not for surgery. So give me 2 care plan for this patient. This is a GCS case. Give me 2 care plan. Are we on? Case scenario 5, Kimberly, no, is it Mrs. Ellie Brooke is a 33-year-old woman who was admitted this morning after a referral from her GP due to vaginal bleeding, abdominal pain, and shoulder tip pain. She's been diagnosed with a ruptured ectopic pregnancy and she has subsequently had an emergency laparotomy. Mrs. Haley has just been admitted into the surgical ward following a laparotomy. She has lost about 500 ml of blood doing surgery and still complaining of pain at the surgical site. Plan a post-operative care. So give me 2 post-operative care plan for this patient. So guys, I'm very happy for your time. This video is almost an hour. So do this assignment, pop your care plan in this my YouTube video, not email because I want every other person to learn. So pop your care plan here. I'll be happy to mark it. Practice the scenario with your pillows, just to adapt to how it works in Osce. If you have any question, feel free to ask. I'll be dropping a video soon on the new test of competency on assessment and on the